Hello everyone, I am Dr. Sumanta Rao, pediatric nephrologist at Neotia Bhagirathi, Women and Children Center. Today we are going to discuss on the medical aspect of urinary tract infection, otherwise called UTI in children. So by far UTI is not that uncommon in our pediatric age group. Mostly they happens around 2 to 3% in case of the pediatric age group in our children, and for infants who are less than 1 year age, there in that case the incidences are far more high, around approximately 10%. And regarding some gender variation, boys are usually more affected in case of infants or the smaller kids, and in case of older kids, girls becomes more affected with these conditions. So what we mean with these things of UTI, that means basically an infection is going on in our kidneys, or maybe the draining pipes of the kidneys. They are also called ureters, or our urine storage capacitor, that is called the bladder, urinary bladder. So any of the three parts of our kidney systems can be involved in case of UTI, and once it's involved, our child usually may complain of pain during urination. They get cry during urination. Many a child can have increased frequency of passing the urine. Sometimes they are passing every 2 to 3 hours of urination act, and after once UTI episode they start passing every 15 minutes. They are not passing much, but passing little urine very frequently. Many of them complain of repeated vomiting, high grade fever, sometimes with some kinds of diarrhea also. And on this aspect, when this child present to the pediatrician or to the pediatric nephrologist, that time we start suspects this UTI and we start investigation. The investigations are not much about. In most of the stable child, only a simple urine test, a urine routine and a culture is enough for the diagnosis. But the trick is how to collect those samples, because for small kids, collecting this proper urine sample is rather easy to say rather than to do, because many times the child will not obey our command. So we have to keep and watch to how to properly collect the urine. And in case of less than 1 year of child, if we have much difficulty in collecting the urine properly, it's better to put the simple catheter in any of the laboratories or in the hospital setup and to get the urine collected. Otherwise, once the UTI is confirmed in the urine routine test and the culture, we may start antibiotics for the treatment of UTI. Most of them are treated with oral antibiotics. Many few who are mostly toxic or who are more sick can require an hospitalization and intravenous antibiotics for 5 to 7 days of issue. Mostly the treatment goes for 7 to 10 days. Few child may require a little bit longer treatment also. And many sick childs, other than urine tests, they can require some blood tests like the kidney function test, the blood infection test, CBC and CRP like this. Regarding this initial test, once the child is being stabilized, many a child after that, in contrast to adults where they are just done urine test, treated and everything is resolved and they forget it. In contrary to that one, for pediatric age group, we usually land up doing an ultrasound for kidney, a good ultrasound from a good center, and many a times as per the age group of the patients and as per the UTI severity or the second episode or repeat episode, we may do sometimes some certain extra tests like MCUG or DMSA to look that these UTI episodes are making some permanent damage in the kidneys or not. Or if the UTI is happening to this kid, is there some underlying defect in the kidneys since birth which makes this child prone to have repeated episodes of such UTI. Anyway, most of these UTIs are well treated, and in long term follow up they don't create much issue. Only certain fractions of these children may face some long term complications. For that reason, we need to keep a good follow up for this patient. And in the background, where is some history of proper urine stream, proper urination habit, proper constipation management. These are also important. This thing has to be taken care of to just avoid repeated urinary attacks, tract infection syndrome. So this is all for the medical part of management. If you have more doubts regarding the medical part of management, you can always contact us through our hospital in 24/7 manner. And in some cases, we need a joint effort to treat these children by our pediatric surgery colleagues also, and that surgical part can be dealt with some our subsequent such videos. Okay, thank you.